Welcome to this presentation. This is the 21st in the series of short videos, each featuring 5 multiple choice questions covering diverse unrelated aspects of psychiatry. Each MCQ has 4 options, of which one is correct. Brief information related to the questions will be provided. These are the topics for the MCQs in this video. Question 1. Which of the following is the mechanism of action of Gepirone? There are 4 options. Please go through the options and make your selection. You can pause while you decide your answer. The correct answer is D. Selective 5-HT1A receptor agonism is the mechanism of action of Gepirone. Gepirone, trade name Exua, was licensed by the FDA in September 2023 for major depressive disorder. The other 3 options also pertain to the mechanism of action of drugs that have been FDA approved over the last few years. Muscarinic agonism is the mechanism of action of xanomeline, approved for schizophrenia. NMDA receptor antagonism is the mechanism of action of esketamine, approved for treatment-resistant depression. Positive allosteric modulation of GABA-A receptors is the mechanism of action of brexanolone, licensed for postpartum depression. So the correct answer is D. In this slide, I have listed some key points about Gepirone. Those who are interested can pause and note down the details. Question 2. Which of the following is correct based on studies using the dispositional greed scale? Please go through the 4 options and choose your answer. The correct answer is D. Younger people tend to have higher greed scores compared to older people. The other 3 options are incorrect. A is incorrect because although greed, envy, and materialism are distinct traits, there is a positive correlation between these traits. B is incorrect because greed levels are higher in occupations like investment banking and real estate, and lower in occupations like nursing and teaching. C is incorrect because men tend to have higher greed scores than women. So the correct answer is D. It should be noted that these are differences at a group level and not at an individual level. In this slide, I have listed some important points about the dispositional greed scale. Those who are interested can pause and note down the details. Question 3. Which of the following disorders is more common in girls than in boys? Please go through the 4 options and choose your answer. The correct answer is D. Selective mutism. Selective mutism is more common in girls than in boys. The other 3 disorders are all more common in boys than in girls. So the correct answer is D. Question 4. The BABS or the Brown Assessment of Belief Scale is mainly used for rating insight in which of the following disorders? Please go through the 4 options and select your answer. The correct answer is D. Obsessive compulsive disorder. The BABS is mainly used for rating insight in OCD and also body dysmorphic disorder or BDD. The Brown Assessment of Belief Scale or BABS is a semi-structured rater-administered scale. It is mainly used to assess insight or delusionality in OCD and BDD. It has also been used in mood disorders with psychotic symptoms, psychotic disorders, and eating disorders. It has 7 items, each rated on a scale of 0 to 4, with a score range of 0 to 24, as only the first 6 items are used for scoring, with a higher total score indicating poorer insight. Based on the total score, insight can be labeled as excellent, good, fair, poor, or absent. This scale has been shown to have good reliability and validity. The final question. According to Freud's structural model of the mind, which of the following best represents the function of the superego? Please go through the 4 statements and choose your answer. The correct answer is A. This statement represents the function of the superego, which incorporates the internalized ideals and moral standards. Statement B refers to the function of the ego, while C and D pertain to the id. So the correct answer is A. There are 3 Freudian models of the mind which he developed over the course of his long career. The first was the cathartic model. In the second topographical model, he divided the mind into conscious, preconscious, and unconscious. And in his final and most famous structural model, he divided the mind into the id, ego, and superego. That brings us to the end of this presentation. Hope you found the information interesting and useful. Thank you for watching.